Good afternoon. My name is David Blackburn. I'm your Belton County Judge. This is our weekly COVID-19 press conference and briefing for the COVID event here in Belton County. I've got a few notes and comments that I'm going to make up front. I'll then turn it over to Dr. Chadwell and let her go through her report from the Belton County Health District. First note I'd like to cover is relative to our enforcement efforts and complaints and compliance checks that we're doing. As of today, we've received a total of 263 complaints or compliance checks. That's an increase of 13 over the past couple of weeks. One other note I wanted to make in terms of our compliance investigations and complaint investigations is that the approach we're taking with enforcement, which is a question that I've been getting quite a bit over the past couple of weeks, is how's enforcement going and how's that working? The process that we're using for enforcement is if we receive a complaint and we do investigate and we believe that there is perhaps grounds for non-compliance in terms of the governor's orders, we are notifying the appropriate state licensing agency if there is one. So for example, if it's a restaurant, a state licensing agency, if that restaurant holds a TABC license, a Texas Alcoholic Beverage Commission license, we are notifying the TABC of a potential violation associated with one of the governor's orders, and then letting TABC take whatever enforcement action they may need to take associated with that complaint. If the agency or the entity or the business does not have a state licensing requirement or holds some sort of state license, then we are reporting it to the state law enforcement agency, which is the Department of Public Safety. Let's see. With regard to the jail, I wanted to give you an update on our, we mentioned at our last press conference, I think, that we did have one correctional officer who had tested positive. That has not changed as of today. We are still at one correctional officer in the jail that tested positive, or that has tested positive. We advised you at the last press conference that we also had requested or put in a call for state assistance for testing, as at that time we were estimating as many as 1,000 or more tests that might need to be done. Subsequent conversations with the state led us to modify our request for state assistance and limit that request to providing test collection kits as opposed to staffing to administer those tests. By doing that, we hope we would substantially expedite the process. We did receive over 1,000 collection kits on May 27th from the state. However, those kits that were sent to us were not just the collection kit, but also the reagent or testing kit process was involved in that. So those collection kits would then need to be sent to a lab in California. The testing turnaround time for that was unknown to us. And as we talked about that and in discussions with the health district about the number of people that needed to be tested, we have re-engaged discussions with a local healthcare provider, Baylor Scott & White, to see if they can locally source the collection kits and do the testing for us. That looks to be the way we will be going. And as of today, we have tested 128 of the jail staff, which includes correctional officers and others. That testing started on May 22nd. No additional positives have been reported as a result of the 128 tests that we have done so far. We still have approximately 108 tests to run. The number of folks that we are testing has decreased because in consultation with the health district, with jail administration and staff, we're not testing inmates at this time. Part of the reason for that is that the inmates go through a health screening before they come into the jail. We have a contractor who provides healthcare services to all of our inmates, both processing in as well as on site. They monitor for symptoms, and if any of our inmates demonstrate any symptoms, then they will be tested. But at this time, there is no symptoms being demonstrated in the jail population. We're anticipating that collections will be completed sometime within the next couple of days and test results within a day or two after that. So hopefully by early next week, we'll have the test results of approximately 230, 240 jail staff that work at our Loop jail. I want to say thanks to our medical contractor at the jail, which is WellPath. Thanks to Baylor Scott & White. Thanks to our health district and to jail administration for all of their work during this entire process of trying to coordinate the logistics of getting all of these folks tested and then maintain the protocols that we need to have in place to make sure that everybody is as safe as they can be. That's my jail update. Another question that I have gotten quite frequently over the past few days is 4th of July activities and events. I have been in discussions with several area cities who conduct some form of a 4th of July event or a festivity. My sense is that most of them have either not made a final decision yet, or if they have made a decision, the decision has been to not to conduct a fair or a festival or any kind of what I would call a congregate event associated with the 4th of July, that what they are going to do is perhaps a fireworks demonstration of some kind, but not necessarily any congregate activities associated with the 4th of July. I am in consultation with the City of Belton officials and Belton 4th of July planners. My understanding is that planning work is ongoing right now. They are expecting to make a decision on the Belton 4th of July activities, I think sometime after the governor's next announcement, which is anticipated within the next few days here, either late this week or early next week. And then one other note that I have, actually two other notes, is of the new positive cases that have been reported. Of note is that 3 of those positive cases were reported as City of Belton staff. All 3 of those City of Belton staff worked in the same building, all became symptomatic over the weekend, and none were symptomatic at work. And if you have any additional questions about that, I would urge you to contact Mr. Paul Romer at the City of Belton. And then my last comment is one of the questions that I received from media prior to this was, what do I think is the biggest challenge for the county over the next year and future going forward? And my answer to that would be trying to determine with some certainty what our health protocols and guidelines are going to be over the next year or so. If those protocols are what they are today in terms of response to the virus or a virus, some certainty in that would be immensely beneficial from a planning standpoint, so that you know what processes, procedures, and protocols that we can put into place and when we should put those into place. That would be very helpful. But I think that's the biggest challenge. And I think the healthcare providers and those at the CDC, those at DSHS, those at the public health district here have got lots of challenges associated with that because the nature of viruses is they mutate and they're unpredictable in some ways, in many ways. And so trying to formulate policies and practices associated with that is a challenge, both in terms of from our healthcare providers, but it also is a challenge for those who have to administer the policies and make decisions based on that. But I'd say that's the biggest challenge, is just trying to understand and gain as much certainty as we can relative to what that response should be or might be as we go forward, and that can help us as we go forward. That's the only question I think I received prior to this. I'll be happy to take any questions right now if you have any for me, and if not, I'll turn it over to Dr. Chadwell, and then I'll come back to the podium if you've got any additional questions. But if you need questions for me right now, I'll be happy to take them.
This is Megan with KWTS.
Yes, ma'am.
I had a question. If you had any input on anything the county, or if you're aware of any of the local cities or doing anything specific for minority or poor communities at this time?
I guess I might ask for a little bit more specificity or clarity in terms of, are we doing anything in reference to pandemic response or I mean?
Yes, for protect them? Any specific guidelines for them?
I'm not aware from my chair anything specific to any specific demographic of the population, save and except one, and that is, or two, I guess, those that are over 65 and those that have underlying health conditions, and the lists are there. But I think all of the guidance, all of the response, all of the assistance is been uniformly distributed across all the demographics, save and except those 65 and older and those with underlying health conditions. And there have been, again, some specific measures recommended for them and some specific protocols set up for them. But other than that, I'm not aware of any. I might add,
Okay, thank you.
well, let me add one comment to that, I guess. And I don't know if it directly addresses your question, but the mobile testing sites that the state has provided, that we've asked for and been provided at multiple locations across the county, those locations were selected in part because we believe that that might be an underserved area in the county. Underserved in the sense that there might be mobility issues, there might be a number of issues that had prevented folks from those areas in the county from being able to get tested or have availability for tests. So I guess the mobile testing might fit into a response to your question, at least in part. Any other questions for me?
Definitely.
Okay, thank you. Any other questions for me? All right, at this time, I'll call Dr. Chadwell.
Good afternoon. I assume most of you have seen the dashboard by now and have seen that we are at 324 cases today. And I don't have a lot to add to that other than to answer the questions that we received ahead of time. So I'll just go ahead and start with those. And then if there's anything else, we can go ahead and address that. First question, it's been almost 2 months since the county had its last COVID-19 related death. What do you think is behind that? Well, I would credit our healthcare providers and the fact that we've had a relatively low number of hospitalizations for a caseload that size means that they can offer the supportive care that these individuals need when there are severe illnesses to help them pull through. So the additional thing I would credit that with is our relatively young population that has lent to a fairly low hospitalization rate. Again, those are hypotheses, but that's what I would answer that question with. 50 Bell County residents have been hospitalized because of COVID-19. What is the average time in the hospital for these patients? What has been the maximum and the minimum time? Most patients have been in the hospital somewhere in the range of 24 to 48 hours. The least amount of time was less than 24 hours, according to the data that I have available. And the longest period was about 5 weeks. What kind of treatments have been administered to those who are hospitalized? Probably a better question for a healthcare provider, but generally supportive care. And how many positive cases resulted from the state's mobile testing sites in Temple, Killeen, Troy, Rogers, and Nolanville? The most recent data I have available is that there were 7 positives, 291 negatives, and 63 were not tested by virtue likely of not screening positive, which was a requirement for testing at those sites. And there were a number of questions about case contact tracing, and I do have an announcement as it pertains to case contact tracing. Now that we've had to kind of roll back our surge, we had about 15 people at one point, employees with the health district, our immunization staff, which were excellent, our TB nurse, who is excellent, and staff from our retail, food, and medical and nursing division outside of immunizations. Again, all of our thanks in the world, they stepped up and they helped out. But now that we're reopening and we're looking at back to school coming after the summer and all of that, they have had to kind of roll back to their normal jobs, much to their chagrin, because I know they still want to be here helping us. But they have rolled back to their normal positions. So right now with the contract staff that we have, some of the part-time staff and help from administrative staff that have the flexibility to do that, we have about 7 people that are still working on it. So we have handed over case contact tracing to the state. The state is taking that component of COVID-19 out of our hands because we simply don't have the personnel to continue doing that. And I have communicated with them in that transition, and transitions are always bumpy, but that seems to have rolled over just fine, and they've taken that over very gratefully to help us out with that. We are still handling our case investigations for our positives. Myself, my secretary, our epidemiologist, we have a contract epidemiologist from state who is helping us, and some of our other contractors. We've all been making a lot of calls and reaching out to those individuals that have come positive and doing our best to keep up with those. But I do expect that as we continue to roll down and our contractors' time expires, that we'll probably have to hand over our case investigations as well. And the final question is, what is the biggest challenge for the Bell County Public Health District? How many full-time employees and part-time employees does the health district have? And have you hired more since the pandemic started? So we have 94 total staff members, but most of them do not work on COVID-19. They work in other capacities and they are grant funded, so they have to work in those grant funded capacities. Like I said, we have 7 people that are currently working either full-time or part-time on COVID-19. 5 of them are part-time designated, either because they are contract part-time or because they have other duties that means they cannot dedicate themselves full-time to the effort. So we have 2 people of that 7 that are full-time dedicated to COVID-19. And so as you can imagine, it's a lot of work for 2 people, but we're doing what we can. The biggest challenge for us right now is fatigue, staff fatigue. We've been at this for a little over 10 weeks now. For some of us, it's been 7 days a week, and it's gonna stretch for a little bit longer. So that's our biggest hurdle at this time. Any questions?
Hi, Dr. Chadwell. This is Noelle with Fox 44.
Hi.
I was just wondering if there's any idea on why Bell County numbers are nearly triple what neighboring McLennan County is reporting.
I've had that question a few times. First of all, McLennan County is not as population dense as we are, so that's probably a contributing factor. And, you know, as far as our population, again, we have that young population that's fairly mobile. I think that likely contributes as well. We also have 3 major hospitals here. I honestly cannot recall how many major hospitals McLennan County has, but we have a lot of essential workers in healthcare and in other capacities as well that are still moving around. So that's likely a contributor. We're also doing a lot of testing locally. I do not know off the top of my head how much McLennan County has done, but all of those things make a difference. And we're a little bit closer to our urban partners in Austin as well, and Georgetown. So the further south you go from Waco, the denser the population gets. And I think all of those things really make a difference.
Hey, Dr. Chadwell, it's Jacob from Telegram.
Hi, Jacob.
Why do you think Bell County has had more testing than all of our neighboring counties, including Williamson? I found that fascinating. I was kind of wondering what you might think is behind that.
I can't really speak for Williamson or our other neighboring counties as far as what their modality for testing has been, but our healthcare providers in particular in the last several weeks have been really ramping up testing, and we've had multiple mobile testing sites locally. But I really credit our recent testing numbers to a lot of testing in our hospitals. They report to me every day, and they have really been busy with testing. Anything else?
Yes, hi, Dr. Chadwell.
Hi.
This is Hunter King with the McLean Daily Herald. I'm just curious, talking about tracing, and how you mentioned earlier that it's been handed over to the state. Can you say when that transition took place?
We started transitioning that over 2 weeks ago. The transition fully rolled over last week, the end of last week. And we've been checking in with them just to ensure that that transition continues to roll as smoothly as possible.
And can you provide a contact with the State Department that we could reach out to about that?
Gosh, the PIO for the state, I don't know that the region has one assigned right now, but Chris Van Dusen is the state PIO. You can just do a Google search for him. The Department of State Health Services press office would be a good Google search, and you can find his name. Like I said, I'm not sure if region has a PIO assigned specifically to them.
Okay, and then the last question I have is, do you know the volume of tracing that's being done at the state level?
Oh gosh, at the state level? No, I do not.
For the county, I guess.
For Bell County, last numbers I received for contact tracing while we still had it was 2,500 some contacts that we had traced, but I don't know what's been added since then.
Okay. Okay, thank you so much.
Welcome. Anything else?
Hi, Dr. Chadwell, this is Megan with KWTX.
Hi, Megan.
I know their data was too small for you to really comment much on some of the trends in ethnicity and race. Just curious if you've seen anything change since we last talked about that.
So the major thing that I have noted is a lot of people are choosing not to provide that data at all. If you look at our dashboard, you'll see a lot of people are just not reporting race and ethnicity data to us at all. So I don't know how much more robust the data is going to be if we're not getting that detail. And we do ask. I have personally begun in the last week calling our active cases, and I do ask the question. It's voluntary, and those that I have talked to, some of them have just said they don't want to provide it. So we do our best to collect that information, but we've got a lot of people that just aren't giving it.
Okay, and then I was also wondering, I've seen a few reports, people are wondering about a positive case at the Sheets in Temple. I don't know if you have updates on it.
A positive case out. Say that one more time for me.
It was a Sheets in Temple. I'm not sure if you're aware if there's a positive case or if a Sheets has been closed.
I have not seen anything for that, but not at this time, not that I'm aware, but that may be something that we're actively looking into.
Okay. Similarly, someone asked on Facebook about an Applebee's in Colleen. I'm guessing that's going to be the same.
Yeah, same.
Okay. Sorry, I have people asking questions on Facebook, so I'm keep track of them. Somebody is aware that you guys are not tracing the forfeit cases, but they're wondering if you're aware of any trends or how those people are doing at all.
We check in on those that live in the county that, you know, if they're hospitalized or things like that, we call and check in on them. But for the on-post cases, no.
That's all for me. Thank you.
Okay. Is that everybody? Okay.
Any other questions that we can address?
Judge, are there any representatives from Baylor Scott and White today?
No, ma'am, they're not.
Okay, thanks.
And the other thing I wanted to announce before we close is it's my intent that this be our last regularly scheduled press conference. We'll certainly continue to do press conferences as they are warranted and needed. But in terms of regularly scheduling them weekly, we'll let events and determine whether or not we need to do a press conference. We will continue to push out press releases, and you can anticipate one of those as soon as we finish testing all of the jail staff. We'll certainly send out a press release associated with that. Maybe a press conference, depending upon what the test results are and what else we need to report. But at this time, I'm not anticipating the need for that. We probably will just push that out in a press release. Our press contact information will remain the same, but again, no regularly scheduled press conferences going into June, at least at this point. All right, if there are no other questions, thank you.